April showers bring May flowers, and April also brings Oral Cancer Awareness Month. This is a cancer that is not in the spotlight much, but it's one that everyone should be aware of. According to the Oral Cancer Association website, every hour, 24 hours a day, 365 days a year, someone dies of oral or oropharyngeal cancer, which is cancer of the mouth or the throat, and this is in the U.S. There are approximately 50,000 new cases diagnosed each year, and of those 50,000 cases, approximately 40% of the individuals will not survive longer than 5 years. The percent is high because the majority of these cases are diagnosed, detected later in the stage. And as with most cancers, early detection is key to your best prognosis and survival rate. At our office, we perform a visual exam plus an oral ID exam with all new patients. We do both of these at no charge to the patient, as we feel it's very important for the patient to receive these types of screenings. We repeat that visual exam at each and every recare. It consists of us looking at all the tissues of your mouth, your tongue, the floor of your mouth, the roof of your mouth, gums, lips, cheeks, and we also will palpate along the jaw and the front of the throat for any swollen glands there. We do the oral ID screening, like I said, with your new patient exam, and then we'll do it whenever requested. When the visual exam shows something suspicious for those that are higher risk, or we try to repeat it approximately every 1 to 3 years. The oral ID exam consists of us wearing special glasses and using a special light to shine over all your tissues. Again, both of these at our office are free, and we believe firmly in these screenings for oral cancer for that early detection. So what are some things you can do in between your dental visits? Check your mouth. It's an individual self-discovery initiative, and the website is checkyourmouth.org. It encourages the public to regularly self-check for signs and symptoms of oral cancer in between their dental visits, and then to seek a professional if symptoms do not improve within 2 to 3 weeks. Some signs and symptoms are sores or ulcerations that don't heal within that 14 to 21 days, red, white, or dark black discolorations of the tissues of your mouth, any abnormality that bleeds easily when touched, any lumps or hard spots, usually on the border of your tongue or the floor of your mouth, any growth of the tissue, or any painless, firm, fixed lump felt outside around the neck that's been there for more than 2 weeks. Smoking and tobacco use is some of the main risk factors for oral cancer, but in more recent years, oral cancer numbers have increased due to HPV, human papillomavirus, specifically HPV-16, which is the virus most commonly associated with cervical cancer. HPV-16 is sexually transmitted and is related to the increasing incidence of oropharyngeal cancer, which most commonly occurs in the tonsils or the base of the or in your throat. And it's due to this that we're seeing an increased diagnosis of oropharyngeal cancers in the younger, non-smoking individuals. There is an HPV vaccine available, and I encourage you to discuss that with your medical professional to see if it's something you or your children should be receiving. And then another way to help lower your risk of oral cancer is early detection. So see your dentist regularly. If they aren't doing the oral cancer screens, ask. If you're a smoker, quit. Also do your self-exams at home, looking in there at your tissues in between your dental visits, and call your dentist if you have any concerns. If you have questions or comments, let us know. I'm going to go ahead and show you how we do our visual and oral ID cancer screenings at our office. I'll have Courtney with me to do that. I have Courtney with me today. She's going to help so I can demonstrate how we do the visual oral cancer screen at our office and use the oral ID. So the first thing we do is the visual cancer screen, and we look at all the tissues. So I'm just going to have Courtney open, and we look at the cheeks, we look at the gums, we look at the lips. All those look good. And then we look at the tongue. And this is the fun part where I say, Courtney, stick out your tongue, and we grab onto that. And we check the tongue. We look underneath at the floor of the mouth. And then we look at the roof of the mouth. Also the throat, where we have you say, ah, ah. Good. And when we're all done with that, we'll go ahead and check along the jawline and along the throat for any bumps or lumps or tenderness. And that completes the visual screen. Next, we'll do the oral ID, where we wear the special glasses and use a special light. So we'll put the glasses on. And we use the light to shine around on the tissues. The light will, if it hits any suspicious tissue, it will absorb the light and it shines back dark and black, stick your tongue out. And so that's what we're looking for.